This video will explain the procedure for draining a PleurX catheter from start to finish. To remove the dressing, gently pull up a corner of the tegaderm and peel it away from the skin. The gauze pad will be removed, leaving the catheter and a foam pad. Be cautious when removing the tegaderm. If the catheter is in contact with the tegaderm and they are firmly stuck together, you could inadvertently pull it out as you remove the dressing. The insertion site will be similar to this. With the dressing removed, first ensure that the cap is in place at the end of the catheter. Then assess for any cuts, cracks, or damage to the catheter. Then assess the site for any redness, leaking, or signs of infection. You are now ready to begin the draining process. Open the PleurX drainage kit and remove the sealed package of sterile supplies. Open the package of sterile supplies and remove the blue tarp from the packaging. It's important to note that this is not a fully sterile procedure, but the supplies provided are sterilely packaged, and you should be careful not to contaminate any of the items you will be using. Remove your clean gloves and dispose of them. Wash your hands, and then don a pair of sterile gloves. Sterile gloves are provided in the PleurX kit. You will now need to set up your sterile field. The first item provided in your sterile supplies is a new sterile cap for the catheter, followed by 3 alcohol pads. Open each alcohol pad and set it within the sterile field. A blue emergency slide clamp is the next item. Set this aside, but keep it readily available. This is for emergencies only, and unless there are complications during the procedure, there is no reason you should need to use this blue emergency clamp. Next, you'll find a stack of gauze pads, followed by a foam pad with a slit in it. Return to your PleurX kit and remove the bottle. Place your bottle next to your supplies. With the tubing, take the tip and place it onto the sterile field. You'll notice a plastic sheath covers the tip of the tubing to protect it from contamination. Close the roller clamp attached to the tubing. When you're ready to begin draining, remove the plastic sheath from the catheter tip and replace it on the sterile field. Pick up alcohol pad number 1. Remove the sterile cap from the end of the catheter and use the alcohol pad to clean outside of the valve. Be careful not to insert the alcohol pad into the valve as it will cause damage to the seal. Take the bottle's tubing and insert the tip into the valve at the end of the catheter. When the two are connected, you will hear a click. Return to the bottle and remove the guard from the plunger. Ensure the roller clamp is closed and depress the T-plunger into the bottle. Now slowly open the roller clamp and fluid should begin to drain into the bottle. Drainage will take 5 to 15 minutes. You should never drain more than 1,000 milliliters from the patient's chest or 2,000 milliliters from the patient's abdomen. As you near the end of the drainage, the fluid entering the bottle will slow down, become more sporadic, and potentially froth or bubble. At this time, begin to close the roller clamp. Take alcohol pad number 2 and the new sterile cap provided in the kit. Disconnect the bottle from the catheter, and once again use the alcohol pad to clean the outside of the valve. When you're finished, put the new sterile cap into place and twist it until you hear it click. It's now time to apply the dressing. Take alcohol pad number 3 and clean the insertion site around the catheter. You'll need the tegaderm soon, so take the time now to peel off the back and have it ready. Grab your foam pad and pull the catheter through the slit so it's in the center of the pad. Coil the catheter over top of the foam pad so that none of the catheter touches skin. Use your gauze pads to completely cover the catheter so that none of the catheter will be exposed to the tegaderm. Place the tegaderm so that it completely seals and covers the gauze pads. Initial, date, and time the dressing.